Hey guys, I just wanted to talk to you about a few interesting bits of information pertaining to COVID-19. It's very peculiar because there's a lot of contrary information on the web regarding the numbers of people who are sick, the numbers of people who actually have died from the current pandemic, and the reports are very unclear as to exact numbers. People at one point they say that there is a certain number of people who died, and then they take it back. They say that they die from other complications. And apparently, some places they are hospitals are anyone who dies. They say just from corona, the COVID-19. So something to look into, something for you guys to do your own homework on. But something that is very peculiar to me is many places have stopped using cash. However, there's pretty much no difference between using cash and using credit card, because even if you don't if they don't take the cash from you, still they don't disinfect the Visa portals, or you still have to touch the credit card to uh, put it into the machine, and you still receive um, the receipt from the cashier in most cases, which could be contaminated, may not be. I mean, obviously, if someone is not sick, then the likelihood is that it's not going to be contaminated, because the only way to really spread the virus primarily is through particulates of fluid that contain the virus when somebody coughs or sneezes around, for them to be transported onto the surfaces of objects. So as long as someone is not coughing or sneezing, such contamination is nearly impossible. And if people are wearing gloves, then most people should be fine. But one thing is very interesting is that if you go to the airport or a regular store, the most places are using the cashier or the clerk, they're using the same gloves over and over again, which means that they're taking pathogens like bacteria and viruses from one person to another anyways as well, which means that even credit cards uh, shouldn't be safe either to use, considering that apparently the virus lives on the plastic a lot longer than on other surfaces. I mean, there's all kinds of different data about how long the virus lives on paper, plastic, and so forth. But it's very interesting because this whole scenario regarding infection, and in particular cash, can be easily prevented by simply installing machines that use ultraviolet light, and um, even you can use oxygen type of chambers to decontaminate all of money. But the main thing is you can have machines that use ultraviolet light and simply put the cash through, and it disinfects the actual bills from the virus or from even any other types of pathogens. So that's very peculiar that the governments are not investing in such technologies which could help a lot of people to go back to work and continue being able to earn a living. Instead, this is absolutely madness, considering some people live paycheck to paycheck and rely on their customers to pay with cash. Not everybody uses credit card, as a matter of fact, to conduct their businesses for many very good and very practical reasons. For example, in Japan, they don't allow you to use credit card in many places. At least it was my experience when I was there. And it's a very clever move, because the less cash we use, the more we live in a digital currency world where your money could be easily hacked or stolen. And if somebody doesn't like you for whatever reason, your money could be blocked, or whatever, or like I said, stolen. This we hear about people's Visa cards and accounts being hacked all the time. So there is really no safety when it comes to that, to this digital currency. Plus, if there is a virus that can hack people's accounts, then people can lose everything that they have, and it can become a big problem. Anyways, the other thing that I wanted to say is that I would recommend you guys start talking wherever you go and they don't accept cash, that you start challenging the whole thing with the credit card, because credit cards are not safer than cash in itself, to be quite honest. Because the person who touches the credit card touches they touch the what's it called? They touch the Visa machine and so forth. And it's quite paranoid, because when you really think about it, people are touching things all over the place. But the main thing is the person coughing? Is the person people who are coughing in particular should be wearing masks and so forth, and even rubber gloves, just to isolate themselves that way from other people. But I do not believe that this makes any logical sense whatsoever, to lock down the entire world and to close down the businesses and so forth. Because if you have to understand why people get sick and why they die. And number one reason why people get sick is because their immune system in many cases is compromised. Doesn't mean that I mean, even in a healthy immune case, people can get sick. But most people who are severely compromised, you're talking about people who are very elderly, people who have stage 4 cancer, who are very immune suppressing medications. Yeah, those kind of people are definitely at risk. But the rest of the population is absolutely in a much better position to be able for their body to fight back the virus, any virus, because this is nothing new. We've been living with viruses for millions of years. And why do I say this about this virus? Is because I personally had this strain of virus in December and I recovered. And many of my patients also had this virus, even though nobody knew that it was COVID-19. And people recovered within 5 to 7 days on an average, by taking natural remedies, things like zinc and echinacea and so forth. I mean, I always say consult your local healthcare professional like naturopath, homeopath, to get the best advice, or Chinese medicine practitioner. But in my frank opinion, this virus already has been present in North America since about November of 2019, and many people have been already infected, and many people confused it with a seasonal flu or pulmonary condition, because there appears to be every year around December many people tend to get sick. Interestingly enough, some people blame it on because of the winter. Some people, but I see this in my practice, that this is a very commonplace. Every year, like on the dot, there is people being sick with all kinds of lung problems around December. So this was no different last year. Many people were infected. Many people didn't know what they had. They were told they had a flu or a cold, and it was ignored. So the facts about COVID-19 are very again. You will hear Trump's advisor, Dr. Anthony Fauci, claim on the news, how scary, how deadly this virus is. But at the same time, Dr. Anthony Fauci wrote in the actual medical journal, New England Journal of Medicine, New England Journal of Medicine, he wrote that COVID-19 is no more serious than a severe flu. And from my experience, based on my case, I had this because I'm quite certain I had this virus. I basically recovered, like I said, about 5 to 7 days. It wasn't pleasant, for sure, but it wasn't deadly. And again, that is a big thing. I further look at this whole situation. I mean, this whole thing is like it's really, there's something more happening here, and I really urge everybody to question everything. Think think intelligently. Don't just accept any information blindly, whatever you hear on the news, because the news is spreading so much fear and so much disinformation, actually. Don't believe me. Like I said, you need to question everything, because your job, everyone's job, and everyone's responsibility is to uh, be responsible for what we think, and for what we accept as truth, or a lie. And it's just a regular, basic human responsibility. So don't believe anything blindly. Question everything, and don't even believe what you've been told already, blindly, without properly gathering all the information, and properly cross-checking many different resources of information, not just the common media ones. But the one thing that I would say is that I see the governments being really behind this virus personally, behind the spread of the virus. And why do I say that? Since the outbreak of the virus in 2019, the virus was told, they said that there was no particular how can you say, mention to the public of the dangers of the virus. The virus was already present in North America. The doctors didn't even admit to that openly. There's not much news coverage about that. And consistently, people who work for the U.S. Canadian government, they were told, they've been telling the people over the, they've been telling people to basically not to wear masks, and especially N95, saying complete nonsense, like that people don't know how to wear the masks, and bunch of rubbish. So basically, to me, that this is like, in my opinion, this is criminal, to tell the public not to wear a mask when the condition is airborne, because it travels. It doesn't just come from the surface of from a door handle or whatever you touch. It comes through the air, especially when someone is sick around you, who's coughing or sneezing, because those particulates will travel through the air, and they get into the lungs through the respiratory pathways, mainly your nose or your mouth, if you're a mouth breather, which is even worse. So to me, the fact that the government has basically told the public over the news not to wear masks is absolutely criminal. They're just actually they promoted the spread. This way they actually promote the spread of the virus, because many people who don't know they're sick, when they do cough or sneeze, they can spread that around, assuming they maybe have a cold or something. And this is a big problem, because you look at countries like China, Taiwan, for example, curbed the numbers of corona quite well, and people are mandated to wear masks. But strangely enough, Canada, United States, that's not the case, and yet this is an airborne virus because it travels through the air. The virus is contained in the droplets that get expelled when somebody coughs or sneezes. This is not rocket science. Every healthcare practitioner should know about this. But many places people will argue with you, and I remember a while back I was traveling and I demanded a mask from the airline, and they said they don't have them. So before I got on the plane, I had a huge argument with a WestJet manager who refused to provide a mask for me, because he said that they don't provide a mask to the customers. I said, well, you guys have them for your workers. Why don't you have them for your customers? Considering planes are closed off spaces. And this guy just continued to tell me he doesn't give them to the customers, even though we all know there is a pandemic going on. And anyways, it became just a major, complete nonsense. He still didn't give me the mask. I ended up buying my own, fortunately, from the store that was just nearby. But it's just really insane when you think about it that the airlines, the governments, the news, they're not telling people to wear masks. To me, this is absolutely criminal, because this is how you actually continue spreading the virus in a primary way. And this whole thing about people dying, people die from all kinds of conditions. So there's been already a lot of information shown that people who supposedly died from corona died actually from other complications that they had prior to getting corona. So, for example, if you take somebody who has cancer, stage 4 cancer, and they're doing chemotherapy, radiation, they have diabetes type 2 and so forth, if they get corona, they're much more likely to die than somebody who is healthy, because it's all about your immune system. If your immune system is healthy and strong, if you're eating healthy food and you're getting all the nutrients in your body, like zinc, selenium, vitamin C, vitamin D, and so forth, and you keep the proper social distancing, wash your hands, wear a mask, you have very low chances of getting sick. But if people are eating junk food, eating sugar, all kinds of crap that's full of toxins, and they're not, smoking and doing, basically trashing their own body and their own health, it's hard not to get sick. So it's all has to do with the immunity, not just, it's not a necessarily deadly virus, because any virus could kill somebody whose immune system is overly compromised. And people who are elderly, who have compromised immune systems, they should be isolated. That way, we can protect them in the best possible way. And basic forms of isolation should be wearing a mask. That's one way you isolate yourself, and protect those who are immune compromised. So I think it's absolutely criminal that the governments have not mandated wearing the masks. It's and the whole thing of the stopping the cash, closing down businesses, and literally ruining people's lives. And people need to pay their bills, right? And buy food, and some places in Europe, for example, people are not allowed to go out. How long can you live without food, or even good water? Many places the water is not really drinkable, even though, you take, for example, LA tap water. It's pretty toxic, for example. So this is something that I urge people to question, and I urge people to even challenge the whole thing with the credit cards, because the credit cards, unfortunately, like I said, there's no difference between using a credit card or using cash. Why? Because if you touch the credit card and you touch the terminal, the Visa terminal or a debit card terminal, the virus or bacteria on that card will go into the terminal. And then if somebody used it before you, you are picking it up on your card. And therefore, you're contaminating yourself as well. And that is a big problem. Okay? And I do see some people swabbing, surfaces, saying that they have things that kill viruses. It's absolutely crazy, because viruses, to kill a virus, you need quite toxic substances to kill them. And what I would say is that a lot of people out there are, when they're swabbing back and forth or in a circle, and they're basically bringing the virus or bacteria from one end to another and back. Absolutely makes no sense. This is no way to disinfect the surface. You always need to swipe away and not reuse the same material. But I see people out there in stores, for example. I went to Home Depot today, and I saw um, I went to Home Depot today, and I saw a guy not wearing a mask, first of all, spraying the handles with some God knows what looks pretty toxic, and then basically swiping back and forth with the same material. Absolutely insane. As there's just no way to disinfect, and yeah, it's pretty crazy. I do urge you guys to do your own homework. I mean, do not. I know there's a lot of fear. There is a lot of like it's affecting everyone right now. All of us feel worried and concerned and afraid, not just because of health, but because also our lives have been stalled, and we all have bills to pay and live and buy food and so forth, and it's like we've been put on house arrest and jailed, which is quite depressing, and also another way to affect the immune system negatively. So I always say one thing, question everything. Do not believe anything blindly. Do your own homework regarding any information being presented to you, and basically I would recommend that you guys go check out more information on my channel. Wear a mask, get yourself an N95 mask if you want to be on the safer side, and look at your diet, what you're eating. Cut out all the junk food and sugar and anything that's gonna compromise your immune system, and start eating healthy. Make much healthier choices of your food, and act intelligently. Stop reacting, and start responding, because we need to respond intelligently to this whole situation, considering that many people are not doing anything about what I mean is many people are not really questioning the information, and people are just getting swallowed and affected by the fear. But anyways, if you have any constructive feedback or any positive advice or suggestions, please share. So we'll share with everybody else on this channel, so we can all come up with some really cool ideas to help each other here. God bless, take care, and have a nice day.